At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management, for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Disease surveillance system in tourist spots, a Chon Buri case. Chon Buri, located on the eastern coast of Thailand, but for global citizens, its well-known tourist attraction is Pattaya City, with a large number of tourists from all over the world. However, for the public health sector, wherever there are large gatherings of people, the chances of having an outbreak of any infectious disease are higher. Pandemic influenza AH1N1 2009 or influenza AH1N1 PDM09 provided a good experience in disease control for health personnel in Chon Buri province. Dr. Vichai Thanasopon, preventive medicine expert, Chon Buri Provincial Public Health Office, said, under the Public Health Emergency Response System of the Ministry of Public Health, the provincial epidemic control system is quite good. During that period of time, upon receipt of a warning of pandemic influenza AH1N1 2009, Chon Buri Province, as an at-risk area, set up a war room or operations center to get prepared immediately to respond to the outbreak through multi-sectoral collaboration with regard to technical capacity and personnel. Warnings were sent to at-risk places, emphasizing awareness, not panic, as we are a province with lots of tourist attractions. Back in 2009, after the outbreak had been found, Bang Lamung Hospital was directed to set up an outbreak response unit. In a normal situation, this hospital is responsible for disease surveillance and providing medical services for Thai and foreign citizens. But during an epidemic or pandemic, its service system was rearranged in such a way that the cases suspected of influenza AH1N1 2009 were separated to get special care, ranging from screening to examination and dispensary, while infected patients were treated in accordance with the disease control process. Dr. Narongsak Ekwatanakun, Director Bang Lamung Hospital, said, "This hospital is close to tourist attractions with a lot of foreign tourists, and there are many foreigners coming in for medical treatment. Our measures are to give importance to screening upon patients' arrival. If suspected of influenza AH1N1 2009, the patient will be isolated to prevent viral transmission and medically treated with other protective measures." The the disease control measures did not start and end within the hospital. Rather, the hospital staff would be assigned to visit the communities, schools, business places, and factories to make the people and all concerned aware of the danger of the disease and its prevention methods. In addition, other measures related to disease investigation and control in at-risk localities were also undertaken. Every step was undertaken according to the action plan, jointly developed by all sectors concerned at the provincial level, including representatives from the provincial administration and public health agencies, as well as other relevant entities. The action plan also clearly specified responsible persons, and exercises were taken regarding disease surveillance, investigation, and containment. After the crisis was over, the review of lessons learned is important for all health personnel involved in disease surveillance and medical treatment. Moreover, public education and communication being seen today is to be carried out so that the service recipients will know about influenza A-H1N1 2009 and learn how to prevent themselves from contracting. Not so far away is the city of Pattaya, which provides a good experience in the control of influenza A-H1N1 2009. Despite being situated under the Chon Buri provincial jurisdiction, Pattaya City is a special local administrative zone, not under the government's central administration, having its own public health programs. Ittipon Kunplume, Pattaya City Mayor, said that Pattaya City has about 6 million tourists each year. The chances of having a disease outbreak transmitted from foreign tourists from all over the globe are very high. Thus, much importance is given to this matter, as it will affect tourists' confidence in our tourism industry. The city has established the Surveillance and Rapid Response Team, SRRT, to take action on outbreak containment related to any communicable disease. This undertaking is carried out at the city level, but for the district and provincial levels, the efforts will be handled by respective district and provincial health officials. Regarding the experience in the control of influenza A-H1N1 2009, Pattaya City found a foreign tourist patient who had contracted the disease and entered an entertainment place. Its health officials could get into the place, conduct the case investigation, and take other disease containment actions to ensure that the disease would not further spread. Within less than a week, the disease was under control. Here is the Disease Prevention and Control section of Pattaya City's Bureau of Public Health and Environment, responsible for disease prevention and control. The Bureau's health officials work together with health volunteers who have been trained and ready to work collaboratively. Public education is an important measure for disease prevention and has to be undertaken in all at-risk places, including guest houses and hotels. In addition to educating relevant personnel at such places, the city health officials also conducted case investigation and disease containment activities. Ittipon Kunplume, Pattaya City Mayor, reiterated that with 6 million tourists each year, it is possible that an epidemic may be transmitted into the city. So the city's focus is placed on preparedness and disease surveillance to create confidence among tourists who will be coming here. After the crisis, the experience in controlling influenza AH1N1 2009 is regarded as an important lesson learned for Thailand. That is the cooperation of all sectors concerned being the key to success in resolving the crisis. Today, even though influenza AH1N1 2009 is not as dreadful as before, the disease surveillance and control remains an important task of the public health sector to be carried out continuously forever.